Calcium hydroxide consists of two pastes. One of them is the base and the other is the catalyst. The instruments needed for mixing calcium hydroxide are as follows: gauze, cotton rolls and small cotton pellets, the calcium hydroxide mixing pad, the calcium hydroxide applicator, the smallest spoon excavator, the explorer, and cotton pliers. Wet the cavity preparation to rehydrate the dentin by using a wet cotton pellet that is blotted. Before placement of calcium hydroxide, the surface of the dentin should be shiny, which is a sign of the dentin being moist. Dispense 1 mm of base and 1 mm of catalyst onto the mixing pad. Squeeze from the bottom of the tubes. Clean the nozzles with gauze and dispense base and catalyst onto the mixing pad. And place the correct lids back on each. For mixing the two pastes, you can use either the calcium hydroxide applicator or the spoon excavator. Mix with a stirring motion until you get a uniform color. Mixing should not take more than 10 to 15 seconds. Then clean your instrument with gauze and pick up a small amount of the calcium hydroxide with the same clean instrument. If you are using a spoon excavator, you can use the back of the instrument or the face of the instrument for placement of the calcium hydroxide. I am now using the back of the instrument. I am now using the face of the instrument to pick up the calcium hydroxide. The decision on which side to use depends on the location and access within the cavity preparation. Apply a very small amount of calcium hydroxide to the deepest portion of the cavity preparation with a thickness of less than 0.5 millimeters. Take special care not to contaminate the other walls of the cavity or the surrounding dentin. If so, you should remove it very carefully. Place a moistened cotton pellet on the cavity opening for approximately 30 seconds. The moistened cotton pellet should not touch the calcium hydroxide. Humidity helps the calcium hydroxide to set properly. Check the setting of the calcium hydroxide by using the tip of an explorer with minimal pressure. There should be no indentation.